Welcome to this Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging and we want to help you be more successful. And our guest today is Scott Martin. He's CIO at Nebraska Department of Health and Human Services. Welcome, Scott.
Great. Nice to be here today. Thanks for having me.
Yeah, thanks for joining us. This is a little twist for us. We often have provider organizations, hospitals, health systems. I love that we have a state department here. But before we dive into some of those things that you're working on, tell us about yourself and Nebraska Department of Health and Human Services.
Great. So, healthcare executive with over 15 years of leading digital transformations, operational excellence, and change management. Big entity here in our Department of Health and Human Services here in Nebraska. We're a $5 billion state agency, which is our Medicaid, public health, mental health issues, IDD, slew of service lines, right over 100 service lines we do here too. One of the biggest agencies in our state here too. So we're hands in a lot of things, if you will. Over 5,000 employees in our agency, and our IT department, a little over 400 employees here too.
It's amazing. Amazing to think about the impact you're having. Talk to us about that. Like, what are some of the unique aspects of working at a state health department, especially as CIO?
Yeah, so it's it's a larger than most organizations that I've been to as far as the agencies and how they're done. So we're kind of a conglomerate of a lot of the big ones from other state may have been. But it is in the healthcare realm, if you will, too. Public health, of course, we look at our population statistics out there too. Mental health, we're looking at those aspects in our communities. Basically, the health of our whole population. And what makes it unique is even though we're one entity, there's multiple divisions that are doing lots of great work out there too. And IT kind of bridges all of, like, I guess, a little bit together, if you will. And it has its challenges because there's so much work going on, not only at the state or federal level, all the changes coming in. So kind of prioritizing those to make sure we're getting the most benefits for IT dollars going out to each one of these divisions. Can get challenging because everybody needs stuff, if you will, but you have to kind of do it in a more systemic approach to make sure you can kind of do everything at once, even though you can't do everything.
Yeah, I think that's really interesting because you do have this diverse set of departments, needs, organizations within your larger organization. How do you approach leadership as a CIO when it comes to things like strategy and execution across such a disparate group of customers, if you want to call them that, I guess, in this case?
Yeah, and it's kind of similar to the public and to the private sector. And the big thing that I like to focus on is the alignment piece of it. And in some organizations where you have maybe one service line, it's a little bit easier. Here, where we have multiple, it's the same, but it's just more grown up, if you will, for lack of better terms. And that the alignment drives the execution. If we're not aligned at the corporate level or strategic area, then the execution is going to fail, right? So making sure that the executive team is all aligned on the priorities that we have, taking those alignment down to, I'll say, our execution level or our PMO office to make sure we're putting that to work correctly. And it's so easy to get off alignment because everybody has great ideas. They want to make themselves look good, agency look good, and help out people. And sometimes it deviates from those strategic initiatives that you have out there. So the alignment piece and refocusing and making sure people are aligning correctly is key. And that's where kind of my role has come into play there too, because there's always systematic improvements you're trying to do, technology debt that you're trying to get over, and then all the functions coming in from the state or federal level, the mandates on that too. So making sure all those stay aligned. And oh, by the way, when you change something over here, it has downhill effects. So kind of being the orchestrator of, I guess, of all these pieces, even though I'm not the subject matter expert in each one of those divisions, IT exactly is all in all of those areas to make sure that you're not duplicating work or wasting resources and time in something that's not providing strategic value.
Yeah, I think that's interesting. I think the other interesting thing is government isn't known for being like efficient and agile. So I'd love to hear like how are you and your organization kind of working to make sure that you can provide the tech solutions in an agile or lean fashion that makes it effective for your organization.
Right. It's such a great question. So I've been in my role a short time. Worked at another state agency before, and it's such a paradox that the state government isn't built for change, but they're one of the most needy organizations to adopt change relatively quickly from the state, federal level pieces like this. And it is kind of it's a change in how states have been organized for years, right? And I was at least blessed a little bit too coming into the role is we had some agile-ish type things going on. I'm an agile coach, so coming in there too, I saw at least the efforts into getting to more of an agile type approach. Were we doing everything right? No. Were we getting all the benefits? No. But at least the mindset was at least semi there too. So we probably I'll say in the IT department, because this is where the systemic approach has to come from. We probably have about 7 or 8 agile teams in the area that are kind of doing it, I was going to say agile-ish, but the mindsets aren't there. They're not doing all the events, the artifacts pieces aren't going exactly how they should be. So cleaning up that is at least a blessing in disguise, so they don't have to start from ground zero. But it's really the only way we can kind of take all the changes coming through and process those and get them turned around as quickly as possible. The old mentality of the waterfall or maybe some of the Lean Six Sigma pieces, it just takes too long to get some stuff done. And if we don't get things done out quicker, we just fall further and further behind. So it's a mindset I'm starting with my group here too. So there's some education on what that means. There's of course the Agile Manifesto and the principles behind it too. And the buy-ins come very quickly, which is good because they see the need for change. What they made some changes, but there's not really working the way they need it to. So we have an initiative out here. We're starting to scale it a little bit more. We have to fix about 4 or 5 of those agile teams pretty quickly. And then we'll start scaling it out to the other areas of IT. The other business partners that I have, I'll say the vision side, if you will, which would be our public health, Medicaid, they know it's coming. We haven't gotten to those areas yet, but I've at least done a good job of educating them of why we need to do this, the good things that Agile will bring to your area. And they bought into that, which is great, because if I don't have alignment at the executive level, this kind of doesn't go as well as it could. So getting that alignment from their side and making sure their buy-in understands what we're trying to do at IT helps our execution go a little bit more quicker. Now, I wish I was good. I could get this done, snap the fingers and it was done, but it's going to be a process. Anybody's other scaled agile pieces, it's not something you can do automatically, right? You got to start, make sure those bases are there. Some of the procedures, artifacts, events kind of go in it's a systemic approach, then scale from there. Because if you scale too quickly, the wall comes crumbling down.
Yeah. No, that's interesting. And you're right that getting the mindset change might be actually the hardest part. We all are so resistant to change in general in our lives. And so if you already have the mindset and the desire, then you're more than halfway there. I think that's interesting.
Correct.
There's a lot happening right now in technology, AI, of course, leading the charge right now. Talk to me about some of the AI projects you're working on. Are there some that you're particularly excited about? I'm sure there's a lot with AI that you're looking at or implementing, but I'd love to hear what are you working on with AI?
Yeah, so it's different coming into the state where we have an AI governance committee, which is great, along with our data committees and all that, which is it's a good foundation. We're probably not as advanced as maybe I'd like to coming in. The 2 things that we are looking at now is something in our customer service and center, the AI piece of that one too, how to kind of grab some data calls coming in there too, to kind of help our customer service people give better support when they're calling in. The other one is it's an EHR enhancement to our progress notes for our providers at our facilities. And that's not really using our data in the house, if you will. It's more on the agentic pieces, listening to the conversations and helping them build those progress notes. So it's more of a time saver, if you will, that we're using there versus the good hard data for a large language model that we would be doing. The pilots we have there going are very small. And the reason why they are is our data is really not centralized in a great way where we can kind of get advantage of all of it. So the pilots we have going on are trying to centralize and clean up the data first, because if those aren't done first, your AI is just going to be a disaster. So we started with some smaller pilots. in our Medicaid space. They kind of say, hey, is this helping us with our claims? Can we get some information from our claims data, stuff like this? Very small pilots at this point. And a lot of that has to do with our time, money, resources to go to those. So the one big beautiful bill that came from the federal government, where a lot of time and resources are being to get to those compliance issues that we have right now. So some of the innovative things, the kind of nice, pretty shiny things that we would like to do, not that we're not doing them, but they're just a lower priority for us at the moment. But once we get kind of some of the compliance pieces out of the way, we do think there's going to be a lot of help that it's going to give us as far as staffing issues and better customer service, and hopefully for outcomes for our populations as well too. Just a little bit behind the times just because of some of the priorities from the federal.
Yeah. I think people forget how much compliance can get in the way of innovation because we have to spend so much time on compliance. I think AI is helping with some of that because it even makes the compliance more efficient while it being innovative. You mentioned the data there, and I think it's really interesting because you have data in so many different, from providers, health, from Medicaid, et cetera, right? I'd love to hear, like what health data do you think is going to be the most valuable for your organization to leverage? And is there any data you kind of wish you had but you don't have, at least not in a usable format right now?
So when we talk about data, it's always one of those words that everybody uses, right? I kind of like to say it's more information. And what information you have is making you help our population a little bit better, making better business decisions, right?
Everyone has data, but not everyone has information.
Yeah, exactly. We have terabytes of data around here too. Are we all using it to the best of our ability? No, we have some initiatives to kind of use that a little bit better. A lot of the data we publish out there is on population health pieces, and that's where our big focus of is, because our outcomes for our population in Nebraska is what we're focused on. We want everybody to be healthier, better. So that's where our big data push is for right now. And we do have some projects going on to kind of help centralize that a little bit better, be a little bit smarter with the data we have, ask those better questions with it. Because even I've been here a short time, people give me a report, I look at it and I'll say, well, okay, so what, right? What is this telling me? And people are like, well, it doesn't tell you anything. Yes, because it's the same report you've been using probably the last 10, 15 years, but it's got to mean something, right? It's a great book on OKRs from John Doerr called Measure What Matters, right? So are we measuring what matters to us at this time? And outcomes is where we're trying to look at mostly right now. So it's the only thing. It's just a big thing that we're looking at because we want our population to be healthier, better. And if they aren't, then where are we missing stuff? Is it more money that needs to go into mental health, or whatever that little niche has to be right there too? We need that data to kind of help us move those dollars to where it makes the most or best impact for us.
Yeah. It's amazing how far we've come from the enterprise data warehouse days, where it was like, we just want all the data and we'll somehow magically get insights. But, that didn't play out, I think, hardly ever. So, I think we've seen a huge evolution there.
Yep.
It's interesting.
Right.
As we wrap up, we always like to end with some career discussion, career advice. What would you say is maybe the best piece of advice that you've been given in your career?
Oh, wow. I've had some great mentors along the way, which is always great. People giving their time. I try to do the same thing back to people coming up as well.
Yeah.
But I think it's being authentic, right? A lot of times when you're coming up, you're known for getting where you are, for knowing all the answers, right? Sometimes you don't know all the answers. It's no way for everybody. It's not perfect. But once you get to a certain degree, you're not going to have all the answers. Ask those better questions and be really authentic, right? Hey, I don't know this, right? What do you think, right? Be a little vulnerable piece of saying, hey, I'm not perfect, even as a leader, or your title may give away that you should know. It's just being, hey, I don't know this piece. I'm going to ask some better questions, maybe understand a little bit better, because people will react and kind of open up and build those trust levels a little bit more when they know you're being authentic. And since I'm a very much of a team type of a leader, if you will, too, I've got to build the trust between my team. If you can't be authentic and kind of promote that trustworthiness, you're just never going to have those high performing teams, which you need in the space, if you will, too, because you have to kind of do more with less. And once that trust factor is there, you can really see your team performance and agility kind of skyrocket, if you will. So that's some of the best advice I got early on from a couple of my mentors, just how authentic you can be, build that trust with your team.
I That's a good one for me as a leader of my organization. I'm just pondering that there's a value, and I don't think I always embrace this of showing some imperfection as a leader. Like it's so like if I show a little imperfection, it allows them to be imperfect. Like
Right?
and that transparency, like to your point of hey, I don't know the answer to this and I haven't done this quite right. Can you help me? That's actually really valuable in an organization. And to your point, builds trust between people because they're not afraid to share their authentic self with you as well. That's really good
Right.
advice.
Yeah, a little bit where that innovation comes in there too. If you, yeah, you want to be make it a safe space to fail fast, learn from it, then improve on it as well too. You're scared to take that failing approach, if you will, then you're going to be holding back or not be as productive or authentic as you can.
Yeah, absolutely. Well, Scott, this was really interesting. A unique perspective for most of us here at the CIO podcast to hear from someone who has hands in so many different things, from Medicaid through providers and public health. So I appreciate you taking time to talk with us and share some of your insights and perspectives on leading such a diverse organization. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcast application. Thanks, Scott.
Thank you. Appreciate the time today.